Hi, I'm Susan Raff, and welcome to Real Talk. Our conversation today is something that unfortunately happens to a lot of people. We end up in nursing homes, and the importance of care that we get. And there's a concern right now with a lot of healthcare workers and nursing staff who have been working many long hours in places that are understaffed, and they're looking for help from lawmakers. So we wanted to join or have joined with us Rob Burrill, who is the president of 1199 SEIU, which is the union that represents some 6,500 nursing home workers in our state. So I want to thank you for joining us.
Thank you, Susan. Good morning.
Right. These are people who work in 60 different nursing homes in our state, and this can be very grueling care, right? I mean, talk to me about some of the things that, people in nursing homes, and also the fact that who's in a nursing home today has greatly changed.
Well, that's a very thoughtful question. All of us, when we think of nursing homes, we're imagining, grandma or grandpa who, just needs a little bit of extra support, has the home as, their community and is, a long-term place where they can live out their remaining years. The profile of who is the typical nursing home resident is actually very different from that. Patients that are winding up in nursing homes these days are much sicker, have much higher levels in terms of their physical needs than were the case in decades past. There are many more residents with psychiatric issues, dementia, Alzheimer's, and other dual diagnosis challenges. And so the work is becoming much more challenging and much more intense.
And it's my understanding that this has been a problem that's been occurring for a long time because Connecticut, like many states, really doesn't have a lot of facilities for these people, those who are younger, who have mental health issues, some physical challenges. So they are all living together in nursing homes along with our grandparents and such.
That's right. The state over the years has closed many of the psychiatric beds that used to be available for particularly low-income folks. We are now seeing that some folks who are members, actually state employees used to take care of at places like Cedar Crest Hospital, which is now closed, are winding up in long-term care facilities and in many cases deal with those different complications. They may be younger, but they are also dealing with, in many cases, addiction issues, mental health issues, and so the job of being a nursing home employee now means that you in many cases are dealing with very aggressive patients who may be dealing with those psychiatric issues, get combative, and there's sometimes physical assaults that are quite serious, leading to workers either being out of work for months or in some cases having to leave the healthcare workforce altogether. So it's a challenging job.
Challenging also, and let us not forget about the pandemic. It's been 5 years since the pandemic, but people in nursing homes really struggled hard because they were in conditions that were very difficult. They lost patients, a very stressful time for all of us, but I would say probably more so for people who worked in acute care or nursing homes.
Very much so. In 2020, our members were sort of at the epicenter of the pandemic. Nursing homes, long-term care facilities is where most of the deaths in Connecticut took place. More than half of the deaths in the state of Connecticut took place in nursing homes. For long-term care workers, it's important to remember that in many cases they are like family to their patients. So at places like Kimberly Hall, where 50% of the patients lost their lives in the first 2 or 3 months of the pandemic, it was traumatic for, of course, the patients, but also the workers. They were getting sick themselves. In many cases, bringing the virus home to the family members, working without PPE. We still have photos of workers who were wearing trash bags, March, April, May, even into June. People were having to fashion their own masks. There were 36 members of our union who actually lost their own lives, in some cases multiple workers at the same facility. And all of that physical, mental, and in some ways spiritual trauma that folks endured during the pandemic is now getting compounded by another issue, which is financial trauma.
Right. Let's bring us up to date. So 5 years later, the pandemic is behind us. Not to say that we won't have another pandemic. Hopefully not. But this week at the Capitol, we heard from many nursing home workers who were pretty emotional and pretty stressed out. No one, I guess, is anticipating this to be a job that you're going to make a ton of money, but it certainly would be a job that you would think that you could afford to live. And we're hearing, and what we heard was that some of these workers are struggling to pay for things like rent and groceries.
This has always been a low-wage workforce. Most workers in nursing homes are making between $18 and $22 an hour. In a state like Connecticut, that is just not enough for folks to live. During the pandemic, there were actually some differentials, which in some cases were between $5 and $10 an hour, which allowed people financially, workers in those nursing homes financially, to actually do a little bit better. And so since then, those differentials have gone away. Inflation has gone through the roof, and people are absolutely feeling the pinch. Worker after worker is telling us that they've picked up a second job if they only had one, a third job if they had two. People are having to, double up with relatives. There are multiple workers who've reported that they cannot afford housing of any kind, and in some cases are living in cars at times with their own children. So we're talking about really serious conditions. People cannot continue to go by with funding that has stagnated for now 2 decades. Some of that was a result of the Great Recession. We're now past the point of economic crisis. The state is being able to accumulate significant resources in terms of its rainy day fund. And so we're asking that some of those dollars be moved to the pain point, which is for these long-term care workers, and of course, really all workers that are publicly funded, whether they're public sector or not. Nonprofit workers, school bus drivers, child care workers, those are not state or municipal workers, but they are funded through our budget dollars, our state budget dollars.
Right, because nursing homes get money from the state.
Exactly.
$18 an hour, $20 an hour, that's not really much more than minimum wage. And we're hearing that some of these workers could make more, maybe at Amazon or Costco. That's a challenge, and I don't know anyone could live in Connecticut and make minimum wage and be able to afford rents, which are sometimes $1,800, $2,000 a month. So that's challenging.
One of our members sent me a screenshot of a job posting at a McDonald's in Norwich, which was paying people $22 to $24 an hour. So people could literally leave their job as a nursing home worker where they take care of people and folks are dependent on them for their livelihoods, pick up a job at McDonald's. Got no anger at McDonald's workers, but the idea that you move from caregiving to making fast food meals and can make more money doing it, that's just not a sustainable situation for nursing homes. We've seen that staffing has collapsed in many nursing homes because you can't recruit and retain staff on the wages that exist, and that has meant that patient care has suffered very significantly in many of the long-term care facilities.
So given that, you are now urging lawmakers on behalf of your members and people who work in nursing homes to come through to support and value what they do. I know I had heard that you have a pathway to $30 an hour. That might be a lot to ask for. What do you think is fair, and how much would it cost the state of Connecticut to raise the bar a little bit for those workers in nursing homes?
Susan, another great question. Our members have been very clear with us that $30 an hour is actually a minimum threshold for folks to just be able to meet their basic living expenses. At $30 an hour, most of our members in nursing homes will still have to probably pick up overtime shifts or work a second job, but they won't be in absolutely desperate straits that they are currently in. That costs money. It's about a $550 million ask for not just nursing home workers, but also group home workers that we represent, to raise people to a rate of $25 an hour over the next 2 years and get people on a pathway towards 30. We really just see that as the price of dignity.
Right, and if you look at it, this is not something that's temporary. It's not something that's going to go away. Connecticut has an aging population. People need to be in nursing homes, and we need care. So we need to be able to recruit people to work in homes. $500 million is a lot. And especially at a time when the federal government has cut millions of dollars in funding. So how hopeful are you, and what kind of discussions have you had with lawmakers about finding money? Because I don't believe it's in the budget right now.
There is currently nothing allocated in the budget. Look, we have a good situation in the sense that the rainy day fund, as people know, is over $4 billion. But that's not sufficient of course, at a time where the federal government is absolutely doing a sort of reverse Robin Hood attack on working class people, raiding working class people's livelihoods to sustain tax cuts for millionaires and billionaires. What we were asking our leadership in the legislature and the governor's office to do is also to raise revenue, right? There are folks in Connecticut who really will not be impacted in any way negatively, millionaires and billionaires themselves, by making a small contribution to our state's budget in greater taxes, which will allow human services fields like long-term care to be funded at a level where workers can live and patients can get the care that they deserve.
So I'm confused. This 500 million, you want it to come from the rainy day fund, but you also want people to pay more in taxes?
Well, listen, if the federal government is attacking Medicaid, which covers 1 in 4 people in the state of Connecticut, we don't believe certainly that working class folks should pay the burden for that. But we've seen that the wealthiest in our state and around the country have been doing better and better, while working class living conditions have been stagnating and moving backwards. What we're talking about is a tax revenue solution that would focus on wealth taxation and allow that money to plug some of the holes that we expect that the federal government is going to be created if they take a chainsaw to Medicaid, which would be tragic. But elected officials right here in Connecticut have both the ability, meaning the power, and the responsibility, we believe, to plug those holes that the federal government is creating. We should not allow our living standards for folks here in the Nutmeg State to be driven down by unelected folks like Elon Musk who just want to steal whatever they can.
So let's bring us up to date. So the contract for these 6,500 nursing home workers expired on March 15th. Obviously, you don't want to strike, but you're prepared to. And when could that be if you can't get lawmakers to the table?
Well, look, we are always hopeful that we can achieve a resolution which avoids a strike. But before the end of the legislative session, we're going to need some solutions. And our members are very, very clear and very, very resolute. Despite the pain of leaving their patients, despite the challenges of going without a paycheck while workers are on strike, they cannot continue to live on these wages and benefits. They need progress, and that's why people join unions. People join unions to be able to have the power to impact things that they cannot impact as individuals. We're hopeful that our state legislature and our governor is going to move in terms of being willing to support these long-term care workers in this vital service.
Is there a compromise? I know that there have been concerns over the years. Nursing home strikes have been averted because there is always some resolution. I know there wasn't during Governor Rowland's era. I believe that was one of the biggest nursing home strikes we had ever seen. But since then, there's been some movement to try to bring both to the table for a compromise. Is there one?
Well, look, compromises are easy if the other side says, we're going to make some moves here. We have yet to hear any discussion from folks at the governor's office or in the legislature in terms of what they are willing to appropriate. But we are talking about the need for significant change. An incremental raise of 2 or 3% is not going to do it when these workers are, again, struggling just to meet their basic needs. They understand that they're never going to be rich, and that's not the ask. The ask is to get to the place where people can pay their bills and do that on one job. One job should be enough, not 2, not 3, not people working 100-hour weeks.
So we've covered a lot of ground here. Before we close out, what do you want people to know? And is there something that maybe we didn't talk about and what's important going forward, and your feelings of bringing lawmakers to the table and getting better pay for these nursing home workers?
I just see the challenge that our members in nursing homes are going through right now is very much connected to living standards for working class people, white, black, and brown, folks of all races, nationally. Living standards have been declining in this country for decades. And in particular, in the wake of the Great Recession, working class people have been asked to make sacrifice after sacrifice during the 2010s. It was going without raises in many cases. The pandemic hit, they were asked to step into the breach and to care for our loved ones in nursing homes when there was nothing to protect them. And then they were battered by inflation. The latest attack, again, is coming from the federal government, which is eliminating this program, Medicaid, which covers 1 in 4 people in our state. So I think that we are seeing a real struggle between some of the wealthiest people in the country and the wealthiest people on the planet who are only concerned about continuing to expand their own billions, and working folks who are having to figure out how they get by without enough resources. We think that this fight in many ways is emblematic of what is taking place across the country. And our members are proud to stand up and say that working people should be able to live on just one job.
Rob Burrill, I want to thank you for joining us here on Real Talk and sharing with us some of the concerns for these nursing home workers. And we'll have to see what happens. Perhaps you can bring lawmakers to the table and find some way to give them a livable wage.
We hope so, Susan. Thank you.
All right. Thank you for joining us on Real Talk. Thanks for listening, everybody.